Hi, good morning. Who speaks?
It's another busy morning at this medical center in Saskatoon. The number of walk-ins here has doubled since the end of summer and the start of cold and flu season.
We're seeing all of it, and there's definitely a lot of it.
Daniel McNeil says doctors here are seeing more respiratory infections and have noticed a gradual increase in severity. Last week, 2 patients with the flu were sent to hospital. Meanwhile, the clinic is also having to manage its caseload.
So far, it's very much on par with last year. And the problem is, though, we're getting so many patients in with it that we have to close the clinic early because we simply just can't take any more patients.
The latest provincial data shows flu cases in Saskatchewan have increased from 42 to 594 positive lab detections in the last 4 weeks. Flu hospitalizations rose to 263 patients over the last 2 weeks compared to 90 the 2 weeks before. 5 deaths have also been reported, including 3 in the Northwest region, an area with no flu-related deaths last year. Health officials are urging more people to get their flu shots. Right now, about 1 in 5 Saskatchewan residents are vaccinated. That number is a lot lower in people under 65, which is concerning for one pediatric specialist.
If you're specifically talking about the pediatric population, what we're seeing at the Jim Pattison Children's Hospital is a marked increase, especially over the last few weeks, in influenza, by far.
Chawla says young children are at a higher risk of severe outcomes with the flu, including secondary bacterial infections that require more hospital care. He says that low vaccination rates can also prolong the flu season.
We've also had a significant increase in the number of hospitalizations this season compared to last year. So currently we have 80% of our reported cases being hospitalized.
Children as young as 6 months old can receive a flu shot at a public health clinic or by a nurse practitioner. Daniela Ponticelli, CBC News, Regina.